Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
Julia Britz is a licensed naturopathic doctor who received her training from Bastyr University in San Diego, California. She currently practices telemedicine and can be contacted at www.drjuliabritz.com, B-R-I-T-Z. She's the director of the Naturopathic Medical Department at the Alternative to Med Center in Sedona, Arizona. Well, good morning. Thanks for being here.
Oh, thank you for having me. I'm excited to be here.
It's a delight. We're thrilled to have the Alternate to Med Center and you highlighted for people, because what we're trying to do in our podcast is expand and rewrite the narrative on mental health. And from what I've heard about you, you're part of that. So thank you. Can you tell us a little bit about what got you into this line of work?
Yeah. So it's so funny that I'm pausing just because you think I'd know the story by now, but I think about it differently over time. And I think that's because I've come at different levels of acceptance of where I was. So right now I'm a doctor of naturopathic medicine, and I work with a lot of people that have OCD, anxiety, depression, bipolar, schizoaffective, or whatever they don't want to label it. And there was a time when I wanted to get as far away from that as possible, because I wanted to make that as big a part of my past as I could. Because for me, I was a really anxious little kid. And I remember being at I forget how old you are when you go to preschool or kindergarten, but it was one of those, little kid things. And my brother dropped me off, and I remember crying and thinking, gosh, everyone is so good at handling their anxiety. Why does everyone look so calm? Why am I so bad at this? And I just thought it was normal to feel super anxious all the time and to always feel this under the surface, this kind of shaky, intense feeling. And it wasn't until I was about 19 or 20 when things got a lot more intense. And there were times where my OCD was really obvious to people, and it was hard to keep it to myself. So, really, really long showers and washing my hands till they bled, that sort of thing, and pretty much housebound. And so I decided that I was going to go to therapy. And after therapy and also seeing a naturopathic doctor, I got so much better. And so much better because, I had so many doctors tell me that I couldn't get better, and that was a motivating factor. So that makes me want to try harder always. But things got better and better and better and better, and it wasn't supposed to happen. So it made me feel, well, if this wasn't supposed to happen and somehow I did it, I want to tell everybody else that they can do it too. Because I think a lot of people feel that way. A lot of people feel like, I can't get better. I'm beyond all hope. I'm way too messed up. And I really wanted to work, and I still do. I still want to work with people that aren't really sure that they're worth it. And I've never wanted to go into medicine with the perspective of, I'm going to be the doctor and you're going to be the patient. I'll be the one up, you'll be the one down, and I'll tell you how this works. To me, it was, I'm always the patient. I'm always going to tell people who I am and what I've been through and say, yeah, I used to do that too. And yeah, I used to have that too. And in med school, they try to really beat that out of you a little bit. They want you to be professional. But I decided that was never going to be who I was when I practiced medicine, because I wanted it to be a team effort. And I wanted to walk that path with a person as much as I could. So it's something that I still practice and try to value over time. And I just hope that I can, whether I open up a lot or a little bit, I hope that I can let people know that there always is something on the other side, even if they've never seen it before.
Well, that's powerful. What would you say are some of the primary factors that helped you make such an improvement?
I think it's two things that were huge for me. One was I did something called ACT, or acceptance and commitment therapy. And that taught me a lot about psychological flexibility. So learning how to change the way I thought about things instead of trying to change the world to adapt to me. I learned how to accept my thoughts as I pass through my mind and practice different skills over and over again. And the other part of it was naturopathic medicine. And it was really, really cool because when I went to go see a naturopathic doctor, I didn't go because I had OCD. I went because I had chronic strep and chronic ear infections and chronic bronchitis, all kinds of just chronic infections. And she just stops and says, "Do you have OCD?" And I was like, yes. And I was really shocked that she'd picked up on that. And so she was using something called bioresonance, where you kind of hold these rods, I guess, or there's different ways to do it, but essentially there's frequencies that go through the body and they detect different signatures of vitamins and nutrients and hormones, you name it. But something for her came up that signaled I had OCD. And I said, yeah, I got OCD, but I'm in therapy. We're cool, good. And she's like, no, we can do things for that. Let's talk about your nutrition and your hormones and let's see what's going on, because you don't just have OCD. There's something else there. And that was the first time I heard that OCD could be more of a symptom versus an actual pathology. So we started working on getting foods out of my diet that were inflammatory or things that I was sensitive to. And we started working on making sure my hormones were in balance. I had terrible PMS and my thyroid was a little hypofunctioning. And we did a lot of amino acid therapy, which is what I specialize in now, is targeted amino acid therapy. And it was just so cool. I felt like someone went in my brain, it took out the OCD part, and I could not believe it because I had OCD for years. So I just, it was an adjustment, but it was a positive one, but also a really dramatic one. So I had to learn what life was like after. But back to the original story, ACT therapy and naturopathic medicine were the two things that worked so well together for me.
Well, so how do you do the assessments for the amino acid therapy that you're doing, that you talk about? What does that involve?
Yeah, I do plasma amino acid testing. So somebody will get a blood draw. And then what I do is I look at they test a bunch of amino acids and different metabolites of those amino acids. And then I look at those levels from a functional perspective, meaning the ratios, like how well does tryptophan line up with tyrosine? Or what does glutamine look like compared to glutamate, lysine and arginine, et cetera. And I see from a functional perspective how well those are in balance, because the amino acids are what create the neurotransmitters. So that lets me see not just what neurotransmitters might be over or under produced, but also what cofactors like vitamins and minerals might be missing. Some of the patterns can be really interesting too. Like if I see a lot of the branch chains elevated, that tells me the brain's inflamed. So there's different markers that I look for, and I can get a lot of information. The more I do it, the more I learn, but I love it. And it's, for me, it's a better tool than urine, because then I'm actually seeing the free state of the aminos versus the metabolites or the breakdown products.
How long have you been at the Alternatives to Med Center?
I'm relatively new there. I started in this last January, and so far I love it. It's been a huge adventure because Sedona is very different than San Diego, which is where I was living and practicing before that. But I also do telemedicine as well, because for me, the computer is a really valuable tool, since when I had OCD, it was where I went because anxiety kept me at home. And I think a lot of people know what that's like. So I do like to make sure I have the computer available. But what I love about Alternative to Med Center is that it's so multifactorial, and there's a huge team effort. So there's a psychiatrist, and then there's the detox department where they do a lot of infrared sauna, physical classes like yoga. So it's well-rounded. And I think that's why I like that approach, because for me, that was mine as well, naturopathic and psychotherapy. So getting to see it all together inpatient, I think helps people get through things a little quicker sometimes. But yeah, so far it's been really, really cool.
So tell us a little bit more about the Alternative to Med Center. Where is it located, and how many can it support at one time?
So Alternative to Med Center is located in Sedona, Arizona, which kind of in the western side. So Sedona is tiny. There's only maybe It's like 10,000 people, something very small. It's in a really pretty house that fits about 17 patients. So each room has 1 or 2 beds, and there's a private restroom, communal eating area. And then in the second building, that's where we do all of our detoxification. So the sauna, the exercise, foot baths, anything like that, that will be in that other area. So we can see up to 17 people. Usually we try to space out how they arrive, and most people stay between 30 and 90 days for the most part, and that depends on what they're dealing with. So we have a lot of people that come in wanting to get off of their medications, or people that come in that have had long-standing bipolar and they want to see if there's a way they can manage that, either with a different dose or maybe something that doesn't make them feel quite so not like themselves. So we try to see if we can get people in a space where they're comfortable with whatever medication they are taking, or not if they don't want to be. We never pull people off. It's just if they want to, we can help assist them with that in a safe way, because it can be quite painful to go through coming off a med without any support.
So if the capacity is 17, how many do you normally have at one time in the facility?
Right now, we have, well, I've only been there since January, so I've seen it at about 10 is where I've seen it get as high as. And currently we have 8 or 9, I think. I think the 9th person is arriving this week. But yeah, it's always really cool to see new people come in. It's sad to see people leave because I get a little bit attached to them. But when they're doing well and they're leaving, then that's a good thing.
So how do people find out about the Alternative Med Center? Where's the draw?
I think from what I've heard, a lot of it's Googling, Cymbalta taper, OCD support, inpatient, holistic. We get a lot for integrative is another word people look to try to find us. And I think I've heard from a lot of people that they've spent a lot of time looking. So, because we don't really advertise per se, we just have the website and people try to find it that way. And there's a few centers that do the kind of holistic approach. And I think people get a little confused as well, because the idea that you can be outpatient, meaning you go to see somebody and you go home, or inpatient, there's so much in the middle. And so there's a fear of maybe I need more help than outpatient can provide, but I don't know if I really need to go inpatient, and they think it's this involuntary thing, but there's so much in the middle. So I think it does take people quite a while to research online and to see what they have available. So, and we've had a lot of people tell us they've known about us for years. They just kind of waited for the right time to make sure they wanted to do it. But yeah, the power of the internet.
Well, that's a blessing these days. How do people fund it?
So a lot of it is
can't
either
be inexpensive.
Yeah, I don't think it is. So a lot of people will do either have their insurance cover it, which is really fortunate. We do offer some scholarship programs to certain people, and a lot of people are self-pay. So there's a whole bunch of different combinations we can do. So I think it's more doable than people think it is.
Well, that'd be good news for a lot of people. I was amazed when I first heard about it that it had been so many years that I'd been in the field and I heard a word about it. And so do you get pushback from other more traditional facilities or psychiatrists?
Not that I know of, actually. And I think it's really cool this time we're in, because there's a lot more people moving toward an integrative model. So I don't know if it's still going to happen, but in August of this year, I was supposed to talk at a conference called IMMH, and that's exactly what I'm going to discuss, is this whole concept of treating mental health issues using an integrative approach. Because for so long, the rehab model has been just the model. And if people, quote unquote, failed it, it was, well, you didn't try hard enough. You failed the rehab model. And it's really blaming the patient for not doing well in whatever program, which I always thought was really unfair, because it's definitely a two-way street. So I'll be discussing the whole history of when did we start treating behavioral health issues and addiction in America? When did that switch to the rehab model? And now we're kind of not switching, but we're progressing from that and evolving to include more things, because if somebody goes off of a medication, there's two reasons why they're in withdrawal. One, it's a chemical dependency and it hurts to be without that. The brain got used to a certain thing. Also, every drug is subtractive. Every drug will take something from the body, whether that's calcium, CoQ10, whatever. So when that goes away, the person is now nutrient deficient in something and dealing with the chemical dependency. So that's exactly where I think we're headed, is how do we support that person to get them their nutrients back using functional testing, and also making sure they're tapering in a way that's very slow, very safe, and very thoughtful. Because the goal is, once that medication is gone, not to get that person back to baseline, because at baseline they had anxiety and depression. That's why they went on the medication. The goal is that they have an improved quality of life after the medication is gone, so that they can stay in whatever place they want to be, whether it's medication free or on a different medication, or in a place they can do therapy or whatever. But I think that's really what's been missing from a lot of these traditional programs, is how do we get that quality of life back after we take away whatever it was that person needed for so long, because they did need it for a while.
Well, and essentially what you're talking about to my ear is the difference between just trying to stamp out symptoms and actually move a person to the place where they can thrive and function at a much higher level, having shifted at a cause level.
Exactly. And symptoms are a huge blessing, because, and not to say I'm happy when people are miserable, nothing like that, but if somebody has a symptom, then at least they know that their body's telling them, hey, something's going on. I need help with this thing. And if we can actually fix that, or at least help alleviate that and get the body what it needs, then that can be really seen. Some people where they don't have symptoms, it's not till later when pathology hits and they had no idea because they didn't have a symptom. And it's hard to think of it in a positive way with mental health, because it can be so disheartening to feel anxiety all the time. But that self-awareness could be a valuable tool going through the program, just so that people know, okay, yeah, this is a little better, this is a little worse. And I go, okay, well, that's helpful. That means we need to go this direction or this direction, and we can navigate together, which I think is so important.
Excellent. You know, I keep thinking, can you tell us a little bit more about the acceptance and commitment therapy and why that seemed to be such a good fit for you?
I loved acceptance and commitment therapy. So I had the choice. I was sitting in my psychologist's office and he said, I'm awesome at both. We can do CBT or cognitive behavioral, or we can do ACT. It's really up to you. The success rates are about the same, so whatever drives. And I was like, I don't know if I want to do exposure therapy. That sounds terrible. He's like, well, it's kind of involved in both, so don't let that be a factor. And he explained both to me and the differences. And what I liked about acceptance and commitment therapy was that it had sort of this spiritual quality to it, where it was less about let's get rid of the thoughts, let's get rid of the behavior, because I just didn't think that was possible. I thought it was more doable and more realistic, get to a place where I could accept what I was thinking without unraveling because I was thinking it. I believed that if I could eventually accept what I was thinking, accept the ruminating thoughts, if it didn't bother me so much, then I naturally wouldn't have a behavioral expression. I wouldn't compulse. I wouldn't feel the need to, because I would be more centered within myself. So that part sounded really good. I was like, it makes more sense. It's kind of more doable to me. And the biggest surprise to me about it was that it was very gentle. I'd seen all these TV shows and heard these stories where people go into exposure therapy and they're expected to do really intense, crazy things immediately. And I was very scared of that, but that was not the case at all. So it was very much at my own pace. I was very much in charge of my program, and I was willing to work it. And I had a lot of support and a lot of compassion. And seeing the compassion from my therapist helped me have compassion for myself. And that was really huge, because it took me a long time to learn that so much of the OCD came from me believing that I was worthless, unlovable. It just created a really nice breeding ground for anxious thoughts to come out and wreak havoc in my brain. And so I remember sitting in therapy thinking, well, I hate my brain. It's a bully. It's mean to me. And I felt like two people because I was so against that part of myself. And that was a hard thought because I didn't understand that meant that I hated myself. I thought that just meant I hated the OCD. It was super challenging to come around and find a way to truly accept and have compassion for that person in me that felt so anxious and had so many obsessions and compulsions, and find a caring way to hold that space in myself and not try to fight it. And that's why I liked ACT so much, because there was so much compassion there. And that's what I think I think a lot of people need that, but I definitely needed that.
Well, that's an excellent example for people. I think it's one of the reasons why we're so blessed these days to have so many different styles of therapy out there, and real committed people doing it. What's an aspect of your work that we haven't even touched on yet?
Well, it seems so fluid, I guess, the way I do things. But I do like a lot of functional testing. So I work with that a lot. I like to look at people's hormones. I love anything I can look at, because for so much of that, whether it's thyroid, lipids, I don't really care. I'll look at all of it. But so many of those, ranges, in terms of, oh, you fall into this range. If your TSH is 1.9 or whatever, those ranges were created such a long time ago. So I like to look at, okay, where do you fall in the range? Where does that tell us you're headed? That gives me a better sense of how the body is transitioning to a state of health or dis-ease. That to me is so much fun and way more interesting versus, seeing later, oh, you're fine. Your levels are okay now. And the liver enzymes look good for the minute, and we'll deal with it when they're out. No, I want to deal with it now so that they don't get out of range. So, and I think hormones are a huge part of that, especially for men too, not just women's female hormones. So we look a lot at that. I work with detoxification. If I'm doing telemedicine, I work with that from a very patient specific perspective. So if someone's at home and they only have access to a few things, or they're very sensitive, that takes a part. And I do a lot of IV therapy, which I think is so essential, because so many people that have anxiety have gut issues. In fact, I've never seen a patient that didn't have gut issues with anxiety. So I do a lot of IV therapy because the benefit is that we can get 100% absorption into the tissues. We don't have to worry about the gut not being able to tolerate something. So I found a lot of value in that. So what I'll do typically is I'll look at someone's blood work. I'll get a sense of what nutrients they really need. Because for me, with naturopathic medicine, it's not about, oh, you're anxious, so you need what supplements good for anxiety. I don't think of it that way. Supplements aren't quote unquote good for anything. It's more like, what does this person need? And I just give them that. That's really as simple as it gets. And one therapy I've been using a lot, just because I've seen so many people so low in that, is something called NAD, or NAD therapy, nicotinamide adenine dinucleotide. Love saying that one. So I've been using...
one more time.
Yeah, NAD, nicotinamide adenine dinucleotide. And that's been a game changer for a lot of people. I do that one so that one is really, really interesting. So NAD, we make that chemical. It's part of the niacin, of the vitamin B3 family. And we make it till about we're 25, and then all of a sudden it starts to slow way down. And those levels get depleted further from drug and alcohol abuse, medications, chronic illnesses, chronics, emotional stress, poor sleep cycles, oxidative stress, even UV sun exposure. So life, really. Most of the time when those levels drop, and really we need NAD to give electrons to the electron transport chain, which helps the mitochondria turn out ATP, which is energy. So in short, NAD is what we need to help our cells get energy. And when we don't have a lot of cellular energy, we really don't feel good. We don't sleep good. Our mood's unstable. Energy levels are pretty poor. We have actually physical pain. So I've been using that in different ways for every person. There's no set protocol I use. I really don't even use the word protocol as much as I can, because everyone's so different. But I've been using that quite a bit, and that's been pretty cool. So
Excellent. It's exciting to hear that your approach is to look at what the individual needs, either what they're taking in or they're absorbing. With something like NAD, after you've done the IV therapy, then how do you help maintain their production or supplement of NAD after the therapy?
the cool thing about NAD is that we're trying to rebuild the stores. So the storage of it will last quite a long time for a lot of people. Occasionally, some people could take, I don't do oral NAD supplements too much just because they get broken down so easily. I don't think they do a ton. But for some people, they do. So we can use that a little bit if someone needs to keep it going. We don't need to keep the doses super, super high when we're just working on maintaining. But overall, what happens is something that that's called the bookend effect. So typically when someone starts dripping, their NAD is not an easy drip. It is not pleasant. Rapid heart rate, shortness of breath, flushing, nausea, doesn't feel so good. We can monitor that to make it better. But the point is people drip a long time. They can drip hours. So what I've noticed is that people will drip a certain amount of time, say like 6 hours, 7 hours. After a few days, they'll start to drip quicker at about maybe 3 or 4 hours. Then once they start dripping slow again, that's the bookend effect. And that's where I notice, okay, their body's starting to reach its limit of how much NAD they want. So even for me, I haven't been able to even take an NAD drip in quite a few months just because my stores are still up. So if I try to give myself an NAD IV, the side effects are so much that I have to drip so slowly, and I can't even get the fluid in. So it's really cool what the body will tell you. And that's really what my job is, to help people listen to their bodies, to create an environment that's conducive to where they feel safe enough to listen and go, okay, what do I need? What do I not need? And NAD is a great example of that, when you can see something so dramatic in that.
So, a lot of people don't have anxiety to the level that they would say is OCD, but they are, I'll call it, riddled with anxiety. Their lives are strongly influenced in an unpleasant way. Are they good candidates for a program like yours?
I think people that are, and it's funny you say that, because I can't remember his name. It was, I want to say Jeffrey Stevens. I could be making that up. He's the guy that came up with schema theory. But whoever that guy is, he wrote a book and talked about how he noticed people that had more severe depression did much better and had their issues resolved quicker than people with mild depression. So he started to wonder, why are people that aren't as severely anxious or depressed, why are they not getting better? Why does it seem to stick around? This gray cloud just doesn't seem to go away. So the book's all about that, this elusive book by this elusive author that I can't remember right now. But my point is, I think that's very accurate. I think a lot of people that are dealing with more of this mild, low-grade, dysthymic anxiety, depression picture, it can be stubborn and resistant. And so if somebody's finding that traditional, and not even traditional, but outpatient therapy going once or twice a week just isn't really working enough, and that on the daily they're just not doing that great, there's something between outpatient and involuntary inpatient. And I think that's actually where our center is a great alternative, because it's voluntary and it's very gentle, no forced meds. We don't hold people down and make them be quiet, like nothing like that. Nothing scary. So I think it can be a really good alternative for some people that are looking at, and that's the thing, I think this conception that people have when they experience mild symptoms is they feel that, oh, well, I'm not that sick, I'm not worth it, and whether somebody's symptoms are extreme, mild, whatever, they are just as valid. And so I think there's a lot of levels of wondering where you fit into what kind of therapy or what kind of program, and then also believing that you're worth the help as well.
Yeah, that's a big issue for a lot of people. If it isn't absolutely crippling, then am I worth the money? Am I worth the time? And the other thing is what you were talking about before. If you don't have the compassion for yourself and what you're struggling with, you can end up just beating yourself up and thinking, well, what's wrong with me? I should just be able to tough it out or change my thoughts or have a better energy level, whatever it is. So, well, aside from yours, which is a phenomenal success story, is there a story that you like to tell people to give them hope about the potential for change or improvement?
I have a few stories, and they're all so different, so I'm just going to pick one. Because I always pick the story depending on the person. But I had one person very recently, really, really sweet girl, and irritable, very sensitive to people's energies, in terms of just needing her own space a lot. Baseline anxiety all the time at about a 6 out of 10. So we looked at her blood work, and so I see that she's got okay iron levels, but the rest of her red blood cells look a little off. And most of the time that's a B12 problem. But I look at her copper levels, so low, major copper deficiency, which can imitate a B12 anemia. So I was like, girl, this is what's going on. Because when we think of copper deficiency, that's depression, anxiety, fatigue, poor energy levels, like all across this. So that, to me, I love that story. So anyways, we gave her a lot of copper, took about a month, but she just sprung up like a little daisy in the spring. And I love that because it's a classic example I have of where it's not up to me to decide what the body needs and go, oh, you're anxious, you need this. I just listen, I look, and we go, oh, it's copper. Okay, let's just do that, And it takes a lot of it's a challenge, it's like, it's fun for me to try to think what the person might benefit from. But when we can actually just listen to the body and go, oh, this is it. And it can be that simple sometimes, which is just really, really cool.
Wonderful. Well, I can't thank you enough for what you do for people and for sharing it with our audience. The Alternative to Med Center is what we've been talking about. Is there a website that you maintain or your own blog that you want to let us hear about?
Yeah, actually, okay, let me give them, and I have to look, but my website, if people want to go and check that out, is drjuliabritz.com. I've also had a blog that I've run for about 12 years, and that's called myocddiary.com. And that's a lot where I started talking about things that I used to try when I wasn't in therapy. And I'd make videos about, okay, I just tried this herb, this is what happened. I went to a free group therapy, this is what happened. So there's nothing like that at the time. And then it really evolved into other people saying what they were trying, and it became more of a community and became supportive for me too. And that's when I learned we are not alone in this thing. Like, we are not. It feels that way, but we're not. Because that, to me, was the definition of truly suffering, was when you believe you're really alone. I do keep that going. And then, of course, it's called alternativetomeds.com. And that's the Alternative to Med Center website. And we've got, honestly, such a beautiful staff there. I'm super, super happy. Everyone is so passionate. And most people have a experience in mental health in some way, so they get it. I think we all kind of do. And that's part of it, is breaking the stigma and knowing that, we've all got our thing, and, we're not totally alone.
Excellent. So myocddiary.com and Julia Britz, Britz.
Yeah, drjuliabritz.com.
Excellent. Well, thank you again so much for being with us. And I'm going to look forward to following your career and seeing what else you learn that helps yourself and others.
Thank you. It's been a pleasure.
Julia Britz is a licensed naturopathic doctor who received her training from Bastyr University in San Diego, California. She specializes in supporting people who are struggling with mental health issues such as anxiety, obsessive-compulsive disorder, and eating disorders. Her passion for working with individuals suffering from these lonely conditions is that she too was once a, quote, hopeless case, close quotes, but she got better. Dismissed by doctors, she was told over and over there was nothing else she could try beyond pharmacotherapy, and so was inspired to create myocddiary.com, a site dedicated to documenting the daily life of obsessive-compulsive disorder and related disorders. Through this project and holistic therapies, she found new levels of wellness, and in 2014 did a TED Talk titled My OCD Diary, An Imperfect Story. Julia utilizes natural and integrative modalities including targeted amino acid therapy, peptide therapy, micronutrient therapy, NAD+, and IV therapy, botanical medicine, and epigenetic analysis. She currently practices telemedicine and can be contacted at www.drjuliabritz.com and is the director of the Naturopathic Medical Department at Alternative to Med Center in Sedona, Arizona.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.